Hi, this is our eval, our hip eval. First, we're going to go through complete history. I'll act as Kaitlyn is the patient. Where does it hurt?
Just all up in here.
Nice.
How long have you had this problem?
It's been a couple weeks now. What type of pain? Now you're the patient. What type of pain are you feeling?
It's like sharp.
We also want to include that we would do bilateral testing on both hips during like muscle testing and special tests, and we will ask for consent. So do I have consent to touch you guys?
Yes. Do I have consent to touch you?
Yes. Do I have consent for the duration of the video to touch you guys?
Yes.
Awesome. Hello. For fracture testing, I'm going to kind of describe like what we might find at a scene and how you can possibly tell beforehand like what it is. So if we found Miss Rylee here on the floor with her leg a little bit shorter and rotated inward, that's how we would know that it's probably dislocated. Whereas if it was shorter and rotated outward, it's probably a fracture. Hello. For fracture testing, I'm going to kind of describe like what we might find at a scene and how you can possibly tell beforehand like what it is. So if we found Miss Rylee here on the floor with her leg a little bit shorter and rotated inward, that's how we would know that it's probably dislocated. Whereas if it was shorter and rotated outward, it's probably a fracture.
Hi. So now we are doing muscle palpations. First, we're going to do the adductors. First, I'll palpate the pectineus. It's the first one. If you're looking at it in that kind of way of Liz's hip, it's like this. Okay. So this is where the pectineus is,
And the pectineus originates from the pectineal line on the proximal ramus and then inserts on the pectineal line on the proximal medial femoral shaft, oblique line which extends from the lesser trochanter to the linea aspera. The nerve innervation is going to be femoral nerve, and then the action is going to be adduction and flexion of the hip.
So next in the order after pectineus is the adductor brevis, which is next. So it's like right there. Pectineus was here. Brevis is there. So I'll palpate that.
And then the origin of the adductor brevis is the anterior inferior pubic ramus. The insertion is the pectineal line. The innervation is obturator nerve, and then the action is adduction, lateral rotation, and flexion of the hip.
Next is the magnus. It's right here.
And then for the adductor magnus, there's two heads. There's the adductor head, which I'll go through first. The origin is the ischiopubic ramus. The insertion is the posterior proximal femur. The innervation is obturator nerve, and then the action is thigh adduction and external rotation of the hip. For the second head, that's going to be the hamstring head. The origin is the ischial tuberosity. The insertion is the supracondylar line, and then again the innervation is obturator nerve, and the action is going to be thigh extension and then internal rotation.
The next is the adductor longus, which comes after the magnus, which is right here.
And then the adductor longus, the origin is going to be the anterior body of the pubis. The insertion is going to be the middle third of the linea aspera, and then the innervation is obturator nerve, and the action is adduction, flexion, and lateral rotation of the hip.
And lastly is gracilis, comes after the longus, and that is right here.
And then the origin of the gracilis is going to be the anterior body of the pubis. The insertion is the middle third of the linea aspera, and then the innervation is obturator nerve once again, and the action is adduction, lateral rotation, and flexion of the hip.
Nice. Alright.
Okay, so then the next one we're going to do is the TFL and the glute max. So for the TFL, this is like our pocket muscle, so we're going to palpate it. It's right here, and then it connects onto the tibial tract, IT band, which then goes all the way down to the knee. So that's that one.
It's innervated by the superior gluteal nerve. I'm saying that wrong, sorry. But it's L4, L5, and S1. And then the action is hip abduction, medial rotation, and flexion of the hip.
And then just to be clear, the origin is at the ASIS and the insertion is at the IT band, and then the IT band runs all the way to the lateral knee. Then I'm going to have you go on your stomach. We're going to palpate the gluteus maximus. That originates on the posterior surface of the ilium up here, and then runs all the way down to the bottom of her hip.
Okay. It's innervated by the quadratus femoris branch to the quadratus femoris and inferior gemellus, L5 and S1, and its action is hip extension, lateral rotation, and abduction.
Okay.
We just wanted to reiterate that the gluteus maximus originates on the posterior surface of the ilium, posterior superior iliac crest, and then the posterior surface of the sacrum and coccyx. So it's all around the iliac and all of that. And then it inserts on the upper posterior surface of the femur primarily to the fascia lata and then iliotibial tract.
Yeah, that one like that. Okay, hello. We are now going to do the femoral triangle, which starts at the sartorius, which originates up here at the ASIS, and it comes kind of down. There it goes. I was like, where did this go? It comes down and across, and it starts on the superomedial tibia. It is innervated by the femoral nerve L2 through 4, and its actions include hip flexion, lateral rotation, and knee flexion.
Just do this one too.
Okay. I was like, huh? And as we palpated before, the adductor longus is in the middle right here. It originates in the anterior part of the pubis, which I'm not going to palpate. It inserts on the middle third of the linea aspera.
You got it.
Aspera, so it's right here. It is innervated by the obturator nerve L2 through 4, and its actions are hip adduction, lateral rotation, and flexion. And because these are the borders of this femoral triangle right here, we can find the inguinal ligament. It's like a cord-like structure there in the middle of the femoral triangle. Alright, so now we're going to test her range of motion for extension. So I'm just going to put this up here. I'm going to try to find the greater trochanter. Jesus, there you are. I can feel her. So I'm going to put that on the greater trochanter and have this in line with her body and hold that down to the best of my abilities. Alright. Put your knee not in the way. Spin. Okay. So we're going to push her in. Alright, and try to extend your leg all the way back towards me as far as you can.
Do it.
Yeah. Alright. That was good. You can go back down. And she had about 35 degrees, which is normal, because it's usually 30 degrees of external. Or, I'm sorry, extension.
Should you do passive?
No, that's muscle testing. Oh, no, you're right.
So go ahead.
I keep getting
Do you wanna just keep going?
confused. That was active. Sorry. Hold on. We're getting there. Back to the greater trochanter. In line with your body. I swear I found it lower now. You're fucking with me. Okay.
It's okay, I have a shorter leg.
I know.
There we go.
Okay. You don't have to lift it up so high. Just be in a normal position. Okay. And now extend as far as you can. Okay, awesome. And then I'm going to just try to take her leg back a little bit further. Okay. Give me that. And it only gave us about 3 more degrees, but
Nice.
still pretty good.
Now I'm going to do a deduction on Kaitlyn. Oh, sorry. Ow. Alright, now I'm going to be doing a deduction of Kaitlyn's hip. I'll use her left leg. So first I'm going to find the ASIS. All right, and then I'm going to line the goniometer up this way. Right there. And then I'm going to instruct Kaitlyn to cross her left leg over to, yep. All right, and I'm going to take her a little bit more. All right.
Oh, it's my turn. Okay. Now I am doing external rotations. Keep coming this way. All right, so I'm going to start. What?
Like angle it down so you can see the. There you go.
So I'm going to take the stable lever arm and put it up. I'm going to find her patella, put this in the middle of the patella, and then I'm going to instruct her to bring her foot towards the other, the other foot. All right, keep it there. All right, so she went about 10 degrees. Then I'm going to push her even more. And that added an extra 2 degrees. So she went like a total of 10 to 12.
Now I'm going to be going through functional testing with Kaitlyn as the patient. So first I'm just going to ask Kaitlyn, I would ask her to do 5 deep knee bends, so 5 squats. You can do like 2 or 3 though if you'd like.
Okay. Do I put my arms out?
Either. Whatever you feel more comfortable with. And then I'm just watching Kaitlyn as she do these. Do you have any pain with those?
No.
Okay. And her form looked pretty good, so I wouldn't suspect a problem from that alone. Now moving on to special testing, I'm going to be doing the Ober's test on Kaitlyn. This is testing I-band tightness. So first I'm going to stabilize her iliac crest. And then I'm going to have you keep your leg straight and pull it back. Then on her knee, I'm going to push down to see if she can touch the table. I can feel as I push it down, she is very tight. So I would say this is probably a positive Ober's test.
Can you do the other side?
It's recording.
Okay.
Doing the same thing on the other side. I'm going to have you bring your leg back. I'm gonna push down. This one feels like not as difficult to move.
Dang.
That's what we're just determined.
Okay. So now I'm going to be doing the scoring test on Rylee. So I'm going to have you lay back. And then I'm going to have her flex her leg like that. And then I'm going to push down on her knee and then move her leg back and forth. And if it's positive, she will feel like crepitus in her hip joint. So I'm going to hold you like this. Do you feel any crepitus?
Nope.
Beautiful. And that would be that test.
Alright, and now we're going to do true leg length. So I'm going to ask Kaitlyn if you can bring both knees up and plant your feet on the table. And now bring your hips up and just come right back down. This is so we are setting her hips and making sure that her legs are whatever they're going to be in real life when she's actually laying down and sitting and not compensating. Okay. So there's 2 ways. The book says that you can just measure straight from the ASIS down to the lateral malleolus, but we are going to measure from the greater trochanter to the lateral epicondyle of the femur. So I'm going to find this on Kaitlyn. Sorry, Kaitlyn. Like it's here somewhere, both ends. There we go. She's got muscular thighs, so I have to dig through that. This is in centimeters. It's not how normal healthcare people do it.
I don't think it matters.
Or inches. I'm doing this in centimeters. I really don't know. Be Canadian for a minute. Right there. Alrighty. So that is around 35 centimeters. So that was greater trochanter to her lateral epicondyle. And I'm going to go from the medial epicondyle to her medial malleolus, which is 37. Oh, if you want it, it's just 35 plus 37.
In centimeters.
So Riley's going to do that math because I can't add.
I can't do it in my head.
I can't add.
It's 72.
Oh, Kaitlyn can do
Wow.
it in her head.
Smarty
I can
Pants
do it.
over here says her left leg is 72 centimeters. Yes.
Not inches.
I could convert to inches, but I don't think it's necessary. Alright, and this one is 38 inches. Plus 38, which will make it slightly longer.
Now we're moving on to muscle testing. So first I'm going to muscle test Kaitlyn's rectus femoris. We'll see. So I'm going to grab her leg like this. I don't know if you can. I'm going to hold it like this through the test. All right. So first I'm going to have you go through the motion of just bringing your leg up like this. Perfect. Okay, and I'm going to grab it here, and I'm going to just provide resistance while you do that, okay? Go ahead. Perfect. And then I'm going to do a break test. Ready? And then don't let me push you down towards the table. Go. Perfect.
Nice.
All right. Next, we're going to do the tensor fascial latae with hip flexed. I don't know if I said that right. So I'm going to ask Kaitlyn to get on her side. And then I'm going to have the leg that's under stay flexed and this one straight. And I'm just going to have you first go through the motion, lifting it up. Perfect. And then with these ones, it's kind of hard to create active length tension, but we want to make sure that Kaitlyn's leg is as far down as the table will let her go. And then I'm going to stabilize here and then resist on her knee. Yeah. All right. So go ahead. Perfect. And then we'll do a break test right there. Don't let me push you down. See? Okay, perfect. And my hand stayed here and then stabilized here.
Okay, now I'm gonna have Kaitlyn come to the edge of the table. All right, and now we are going to test Kaitlyn's hamstrings. So I'm gonna have her come all the way up here as far as possible, and now kick all the way down. Awesome, come back all the way up. And I'm going to resist and go ahead. Awesome, and now we're gonna do around halfway. I'm gonna pull up, and I want you to keep pushing down. So don't let me pull your leg up, okay? All right, there we go. And now we're gonna test her glute minimus. Yeah, sorry, I forgot what we're doing. All right, so we're gonna have Kaitlyn get on her side, and I want her one leg, keep that crunched up, put this one all the way up. All right, so that's the motion that you're gonna go through, okay?
Wait, I'm going up.
Yeah.
Okay.
You're going up. Yep,
That.
there you go.
That
So
was-
then go ahead and go all the way through. Awesome. Come back down. And I'm going to make sure to stabilize at her hip and resist down at her knees. So go ahead. Awesome. Now we're going to go around like halfway. And go. All right. There we go.
All right. And the last one is the Taylor's test. If you want to go ahead and go up there. Gotta fix my hair. Okay, so I'm gonna have you flex up that knee like that. And then for this one, I'm going to have, we're testing the sartorius. So I'm gonna put one hand resisting here and one hand, it's gonna be more like this. One hand here and one hand here. And she's gonna go through the motion of bringing her heel to her opposite knee. So go ahead and do that like without my help. Like that. And then I'm gonna do some resistance. So go ahead and
You good?
yeah. And there we go. And then we're gonna do a break test. So I'm gonna push on your knee and pull out. You don't let me do that.